It's okay. Thank you very much for invitation to speak about will be on a novel antiparkinsonian and neuroprotective drug hemantane. And dopaminergic neurons cause structure of the substance was synthesized in Zakosov Institute of Pharmacology, and it was preclinically studied according to the guidelines for preclinical studies of potential antiparkinsonian drugs. And the reference drug was hemantane. In simplified manner, I have to stand here. In simplified manner, the pathophysiology of Parkinson's disease could be presented as dopamine depletion and overactivation of cholinergic innervation. And the models of Parkinsonian syndrome which I used, these are the models of dopamine depletion and the models of hyperactivation of cholinergic system. In these models, in the models of dopamine depletion, hemantane was more active than neuroleptics, and the models with selective dopamine neurotoxins, MPTP, MPP+, and 6-hydroxydopamine. And hemantane was active in all these models and was more potent than hemantane. In the models of cholinergic hyperactivation, hemantane decreased tremor, duration and severity of tremor caused by erecholine and oxytremorin, and hemantane had no effect in these models. The next study was on the mechanism of action of the drug. We use intracerebral microdialysis in freely moving rats, and it was shown that hemantane increased extracellular dopamine levels in the striatum and caused a concomitant significant decrease in the efflux of DOPAC, which could reflect the decrease in dopamine metabolism and was ascribed to the possible monoamine oxidase inhibitory properties. Now, when we studied the effect of hemantane upon mRNA levels of MAO-B, DOPAC, and dopamine transporter in rat striatum, it was shown that after single injection of hemantane, decrease in MAO-B and DAT mRNA expression and increase in mRNA levels of DOPA decarboxylase were registered in rat striatum. And it was supposed that realization of dopaminergic activity of hemantane could be via metabolism decrease, reuptake decrease, or synthesis increase. In the in vitro study, the effect of hemantane upon MAO-A and MAO-B in rat's liver mitochondria, the study of hemantane upon activity of MAO-A and MAO-B in vitro, it was shown that hemantane had no effect upon MAO-A activity and had some MAO-B inhibitory activity. Then several different studies were performed to investigate the effect of hemantane upon monoamine oxidase B. It was shown that hemantane in vitro prevented the effect of deprenyl, irreversible mechanism-based MAO-B inhibitor, and hemantane interaction with active site of MAO-B was proved. Chronic administration of hemantane to mice during 21 days did not influence MAO-B activity assayed in isolated brain mitochondria. However, sensitivity of MAO-B to deprenyl injected to animals right after last administration of hemantane decreased. And combined administration of hemantane with deprenyl caused less pronounced irreversible inhibition of mitochondrial MAO-B compared with the effect of deprenyl alone. So hemantane is a weak, reversible competitive inhibitor of MAO-B. These are the results of the study of effect of hemantane upon dopamine reuptake in rat striatum synaptosomes in vitro. You can see that hemantane as well as amantadine both inhibited dopamine reuptake, but hemantane was active in lower concentrations. These are the results of the study of hemantane upon dopamine transporter protein content in rat striatum homogenates ex vivo. It was shown that hemantane decreased the content of dopamine protein after acute and subchronic administration. The next study was on interaction with NMDA receptors. You know that excitotoxicity mediated by activating NMDA receptors is involved in the pathogenesis of chronic neurodegenerative disorders, and it is known that amantadine and memantine are antagonists of the NMDA receptors. And using patch clamp techniques, it was shown that hemantane produced a concentration-dependent NMDA channel block, and IC50 was very close to those of amantadine. And these results were confirmed in the radioligand assay using labeled MK801, and the conclusion was that hemantane is a low-affinity NMDA antagonist. It is known that oxidative stress play the main role in the pathogenesis of all neurodegenerative disorders. And there are a lot of questions, is it a cause or consensus, but antioxidants are widely used in the treatment of neurodegenerative disorders. And to study this possible effect of hemantane, we use the model MPTP Parkinsonian syndrome in C57 black 6 mice, and we use preventive 5 days before MPTP, and then together with MPTP administration of hemantane, and revealed significant increase in levels of lipid peroxidation markings, malondialdehyd and conjugated DNAs in MPTP-treated mice, and administration of hemantane significantly decreased this effect of MPTP, and this effect of hemantane could be ascribed to the antioxidant properties of the drug. The next study was upon anti-inflammatory activity of hemantane. We used several models of peripheral inflammation. In the models on concavalin A and carrageenan-induced poedema, hemantane significantly decreased inflammatory reaction, and the reference drug was diclofenac, and some doses of hemantane effect in some doses was even higher than that of diclofenac. And in the concavalin A model, we also assess the levels of pro-inflammatory cytokines and revealed that administration of hemantane significantly decreased the level of cytokine interleukin 6 in plasma. That is one more model, acetic acid-induced peritonitis in mice, and hemantane decreased the intensity of exudative reaction. And we know that a large body of literature supports the idea that inflammation exacerbates neurodegenerative pathology and play a role in disease progression, and even could be initiating process. And such role of peripheral inflammation is also widely investigated and proved. So anti-inflammatory effect of hemantane could contribute to its neuroprotective potential. The next step was the model of neuroinflammation, central inflammation, which we performed in rats. We used unilateral injection of lipopolysaccharide into substantia nigra, and hemantane was administered 1 day prior to LPS and then for 14 days. It was shown that in animals with LPS, it is the model of neuroinflammation, and it is also a model of Parkinsonian syndrome. And it was shown that in animals with LPS, the progressive body weight loss was registered, and hemantane significantly prevented this body weight loss, and significant motor disturbances were registered in the rats with LPS. We used test cylindra, and the percent of contralateral to the side of operation 4 touches of the wall, and hemantane was also effective in preventing these motor disturbances. There was no significant difference between LPS and sham-operated animals. And in this model, we also tried to assess the levels of TNF-alpha, interleukin-1, interferon gamma, and monocyte hemantrectin protein in plasma. And increase in MCP1 in LPS group was revealed, and hemantane prevented this increase. So this is a picture of the pathogenesis of Parkinson's disease, etiological and pathogenetic factors of Parkinson's disease. Pathogenesis represents molecular events that led negral neurons to death. And what do we know about hemantane today? It could prevent glutamate toxicity, oxidative damage, inflammatory processes, cytotoxic cytokines, and probably neuronal death. Hemantane has complex mechanism of action targeted upon several main underlying disease processes and probably have neuroprotective potential. To support this idea, we use a model, in vitro model of dopaminergic neurons, 6-hydroxydopamine induced in injury in neuroblastoma cell line. And the reference drug was also amantadine, and we use two regimes of administration, before 6th order and after 6th order. And it was revealed that hemantane was effective in preventing cell death in both these regimes. And amantadine was effective only when administered to the cell medium after 6th order. Basing on these results, we studied the effect of hemantane in the model of premature stage of Parkinson's disease. We used bilateral administration of MPTP into substantia nigra in rats. Hemantane and amantadine were administered 5 days before stereotaxical surgery and then for 21 days. The premature stage, the model of premature stage is characterized by the absence of motor symptoms, cognitive deficits, and depressive-like behavior. So we used to assess motor deficit rotarod test. You can see that there is no difference between all the groups. This proves that the model is really the model of premature stage. But animals with MPTP demonstrate depressive-like behavior, time of immobilization in forced swimming test, and cognitive decline in passive avoidance test. Both hemantane and amantadine prevented cognitive disturbances and depressive-like behavior, but antidepressive effect of hemantane was significantly higher than that of amantadine. To assess possible neuroprotective potential of hemantane, we also use model of intracerebral post-traumatic hematoma in rats. These experiments were performed together with Valentina Krajneva. She is also a participant of our symposium. And in this model, we use two regimes of administration, intravenous and parenteral intraperitoneal administration of hemantane, and revealed that hemantane was effective in, as well as amantadine, was effective in preventing memory disturbances and motor disturbances, and both drugs significantly increase survival of the animals, but effect of hemantane was more consistent in preventing memory disturbances, especially this intravenous administration of hemantane in the dose 5 milligram per kilo. So hemantane has complex mechanism of action. It is low affinity in competitive NMDA glutamate receptor antagonist. It is model reversible MAO-B inhibitor. It has some antioxidant activity, anti-inflammatory activity. It is a modulator of dopaminergic and serotoninergic receptors and monoamine transporters. It has no adverse effects, sedation, stimulatory, addictive potential, cognitive disturbances, and the data obtained allows to suppose possible multi-targeting the pathogenesis of neurodegeneration, and to suppose that hemantane is antiparkinsonian drug with neuroprotective potential and with possible disease-modifying activity. But these are only suppositions. What do we know about hemantane today? It is really a novel antiparkinsonian drug. In clinical study in patients with early stages of Parkinson's disease, hemantane reduced main Parkinsonian symptoms in daily dose 25 milligram. And nowadays, clinical study of hemantane continues. And this is our research group of the Lab of Psychopharmacology, which performed the most complicated experiments with modeling Parkinsonian syndrome. And these are people who contribute to this study and are not at the picture. And there are a lot of people who did contribute and still contributing to the introducing hemantane in clinics. Thank you very much.